Shell shock, traumatic war neurosis, combat exhaustion. They're all terms once used to describe this disorder. Hi, I'm Dr. Bill Easton. Today we look at post-traumatic stress disorder. The term describes any long-term reaction to war zone exposure. Symptoms can include hyperarousal, flashbacks, nightmares, and a restricted range of emotions. It can linger, reactivate, and even present itself as late as 50 years after exposure.
Welcome to a feature edition of specialty programming brought to you by the HealthSat Network. The world-renowned Dr. Donald Low is our physician in the spotlight. His topic today is antimicrobial resistance and its links of the epidemic with other countries. We will also have a discussion with Dr. Low on what the future may hold.
What's right and what's normal for one couple will be quite different than what's right and normal for another couple. And there's no right or wrong, there's no average, we often look, I think, in our society to standards we're supposed to attain, and that's just not true in this area.
I would like to ask members of the panel, sex is hard to talk about within medical practice. Patients have an awareness that doctors aren't really prepared to talk about sexual concerns. How do you approach this within each of your individual practices?
I think it's hard for doctors particularly to initiate the discussion, but once you get the ball rolling, patients, at least in my experience, are very easily, are very ready to talk. Once you open the door, once you get the ball rolling.
Recommendations that come out of a conference like this affect what we do in rural practice.
I have the pleasure to introduce Dr. Howard Rabinovich.
If I can really give one message to you all.
Ultimately, it's the politicians who pressure the learned colleges.
Physicians are really never taught how to deal with stress. They're taught what's expected of them.
The physician distribution is a major problem, as it is for all of you in your countries, I'm sure.
So should we be concerned about stress in physicians?
Our topic today is physician stress, and Dr. Marjorie Docherty can relate firsthand to the demands and stressors of family practice, having worked in both remote and urban communities.
And in fact, the loss of that goodwill is phenomenally costly, because when the physician sees the whole family and mum says, could you just look at Johnny's toe? The physician used to look down and say, yeah, Johnny's got an infected toe, have some whatever. Or Johnny's toe is fine, and then not bother pulling the chart and billing for it.
Welcome to House Call. Today's topic is complementary medicine and is presented by Dr. Mel Borens, a family physician and assistant professor at the Faculty of Medicine at the University of Toronto.
In the late 1970s, there was a movement back to a more humanistic, natural approaches to dealing with health and illness. And the whole area of holistic medicine began. Over the last 25 years, the term has been changed to talk about complementary medicine, which really was medical doctors using forms of so-called alternative techniques, alternative in that they're not part of mainstream medical education and not practiced necessarily in hospitals on a routine basis.